But the reforms were not aimed at curing poverty. Disease and ill health continued to be major problems for the working classes. There is very little film from the beginning of this century, but this was shot in 1946 to show the Victorian conditions that still existed, 75 years after the reforms.
Published by the local authorities all over the country.
Poverty meant that people had to carry on living in very unhealthy conditions. Poverty also meant that people ate cheap food. Tea, bread and margarine were the main foods of the poor. Poor people could not afford to eat the kind of food that provided vitamins, minerals and enough calories to protect them from illness.
When the boys of the Navy leave their
Keeping clean was still difficult.
where some 7,000 people are still living in slum conditions.
The effect of poverty on health was still very obvious.
Some 8,000 slum dwellers.
Council records show an increase in death rates amongst very young children.
The home of Drake, of whom she is justly proud.
In 1840, 144 out of every 1,000 babies had died. By 1899, it had gone up to 163 babies in 1,000 who died before the age of 1. By now, working people were beginning to get organised into groups which demanded changes. There were many different political and workers' groups. One of these was the Women's Cooperative Guild. The Guild was set up in 1883. It was one of the first organised women's groups and fought for government action in health matters, such as maternity care for pregnant women, childcare, free school meals for the poor, and cleaner streets and housing. Meetings were held all over the country. This is what one member of the Guild wrote.
We were taught about vaccinations and death rates. One speaker told us about the public health laws and showed us how the water supply got polluted. After this, we sent up a list of questions to the local health committee. The mayor wasn't very happy about us asking for information, but in the end, he was forced to answer our questions.
The British Empire also needed many more able-bodied people. The government wanted to send fit, healthy men to administer the empire. And the armed forces wanted to see health measures brought in, because during the Boer War, fought from 1899 to 1902, many recruits had not been fit for service. In Manchester, for example, out of 9,000 recruits, only 1,000 were fit for service. As a result of this concern, a parliamentary report was published in 1904. This report asked the government to get rid of overcrowded housing, control smoke pollution, give school children regular medical inspections, set up day nurseries for the children of working mothers, and stop selling tobacco to children. The massive concern from all sections of society meant that the 1906 Liberal government passed new laws. The kinds of laws that had never been passed before, to give poor people help. 1906, school meals were provided for needy children. 1907, schools had to give medicals to children. All births had to be notified to the health visitor. 1908, old age pensions were paid. 1909, the building of back-to-back housing was banned across Britain.
When the housebreakers take charge, you can really see how rotten these places are.
At the beginning of the 19th century, there was little government interference in health matters. By the beginning of the 20th, there was a lot. People began to accept that poverty might be the cause of disease. They also began to accept that poor people could not be blamed for poverty. Today, the government takes responsibility for the nation's health. But the arguments about how much the government should interfere continue. How much government intervention do we need to make us lead healthy lives?